Hi, my name is Dr. Wes, and today we're going to discuss adult still disease and neuronal linkage. So, what is the adult still disease? Adult onset still disease (AOST) is a systemic autoinflammatory disorder. Major mediator in this disease is IL-1 beta, IL-6, IL-18, and TNF-α. Macrophages and neutrophil activation also is a part of this disease. Neuronal linkage is indirect but clinically important through hypothalamic fever pathway, nociceptive pain signaling, and HPA axis interaction. These are the major players in this disease. Overview. Key features: autoinflammatory disease driven mainly by dysregulated innate immunity. Typical manifestations: daily spiking fever, transient salmon-pink rash, arthralgia or chronic inflammatory arthritis, sore throat, myalgia, lymphadenopathy, and hepatosplenomegaly. Laboratory clues included ESR, CRP, leukocyte with neutrophilia, often very high serum ferritin, RF, and AN usually negative. Clinical pattern: one inflammatory episode followed by remission, recurrent flares with symptoms free intervals, persistent synovitis and joint damage risk are there. Important concept about this disease: OSD is primarily immune inflammatory disease. Neuronal effects are secondary to cytokine-driven inflammation and neuroimmune communication. Core inflammatory pathophysiology: the triggers infection, genetic susceptibility, innate immunity, dysregulation, macrophages, neutrophils, dendritic cell, and inflammasome pathway. Cytokines involved in this IL-1 beta, IL-6, IL-18, and TNF-alpha. Systemic consequences: fever, rash, synovitis, fatigue, acute phase response, organ inflammation. Severe complication includes MAS, macrophages activation syndrome. Neuronal linkage: how neuroimmune crosstalks involve hypothalamic fever regulation, in which cytokines stimulate prostaglandin E2 and reset the thermoregulatory set point. Pain pathway: inflamed joints, prostaglandin, bradykinin, and cytokines that activate nociceptor and transmit pain. Autonomic nervous system activation: sympathetic activation, chills, sweating, tachycardia, and malaise. HP axis: hypothalamus, pituitary, adrenal axis, and neuroimmune interaction. Inflammation signals the hypothalamus and pituitary, and endogenous cortisol attempts to counter inflammation. Mechanism: um, hypothalamus mediated fever, IL-1 beta, IL-6, TNF-alpha acts on brain endothelium and circumventricular regions. PGE2 acts on hypothalamic regulatory neurons. Uh, Clinical results: daily high fever, chills during temperature rise, sweating when the set points normalize. Cytokines: PGE2 synthesis, hypothalamic activation, raised set points, and spiking fever. Key neuronal points are important. There is no directly involvement of the brain in this disease, but hypothalamic neuron translates cytokine signal into characteristic fever pattern. Pain and fatigue: mostly synovitis and periarticular inflammation release mediators such as prostaglandin, prostaglandin, substance B, IL-1 and TNF-α. Pain impulses, ascending pathway relies signals to thalamus and cortex where pain is perceived. Clinical outcomes: arthralgia and arthritis pain, myalgia and body aches, fatigue and reduced functions. Autonomic HP axis, systemic inflammatory stress can increase sympathetic output. Autonomic activity amplifies the subject burden of the disease and the HP axis involvement, uh, which in turn uh, stimulates hypothalamic CRH release, pituitary ACTH release, and adrenal cortisol excretion. Cytokines, hypothalamus CRH, pituitary ACTH, and adrenal cortex release the cortisol. Diagnosis of adult still disease. Then these are the diagnostic patterns. Um, Suggestive finding: high spiking fever, evanescent rash, arthralgia, arthritis, sore throat, lymphadenopathy, hepatosplenomegaly, laboratory profile: ESR, CRP, neutrophilic leukocyte, uh, very high ferritin, RF and ANAU negative. Treatment include NSAIDs, uh, DMARDs, biological therapy, IL-1 inhibitors, IL-6 pathway inhibition, supportive care analgesia for nociceptive pain, monitoring mass and organ involvement, function rehabilitation if chronic articular disease develop. Prognosis and complications. Prognosis outcome varies with disease pattern and response to treatment. Other experience recurrent flares or chronic destructive arthritis. Early recognition and target therapy improve quality of life and reduce complication. Important complications are mass macrophage activation syndrome, persistent inflammatory arthritis and joint damage, sinusitis, pericarditis, and periodontitis. Hepatic involvement should be there. Marked inflammatory uh, patterns are there with constitutional symptoms. Neuronal involvement is secondary yet clinically meaningful. It shapes fever, pain, fatigue, and autonomic symptoms. These are the summary and key messages. Adult still disease is cytokine-driven autoimmune inflammatory disorder. Uh, neuronal linkage is secondary, but there is a involvement of HP axis and autonomic activation, nociceptive pain pathways, and hypothalamic fever regulation. These are the pro-inflammatory cytokines that are released during the inflammation and fever to neuroimmune systems. Diagnosis clinically as uh, inflammatory markers, ferritin elevation, exclusion of mimicking conditions. Treatment targets systemic inflammation, controlling inflammation, also reduces neuronal symptom generation. Thanks and regards. Please like and subscribe to this channel for further disease discussion and mechanism of the disease. Thank you so much.